Hi, my name is Dr. Ashraf Affan. I'm the CEO of Angel Kids Pediatrics. Angel Kids Pediatrics is a group of pediatricians here in Jacksonville, Florida. We cover the entire city. We care for around 35 to 40,000 families, and we are around 100 plus employees with 25 to 30 providers that are doing what we call integrated comprehensive primary care. So our providers are caring for newborns all the way to age 18, and in our practice we have 3 PhD psychologists who are doing the behavioral aspect of the pediatric and adolescent care. Our practice is really a practice of the future of pediatrics. We do population health management. We get involved in the social determinants of health. We follow our patients beyond the walls of our clinics here. So we are very involved in our community and doing a lot of school programs and community-based programs for our patients, aiming at the well-being of those patients, and hopefully do a lot of prevention programs and keep those kids away from the clinics and the hospitals as much as we can. As a matter of fact, over the last few months, and especially after the pandemic, we started to know that the world is changing, and people started to work from home. We started to be very carefully looking for things that we haven't been even aware of before. Tracking issues with the COVID, with the pandemic, making sure that in every business we are not far from what other people are doing, and making sure that we could track our employees. We were looking for some good, simple solution. We felt that Solve Care was a very good solution fitting to our needs on how we can stay connected with our employees at Angel Kids Pediatrics from every different department, especially when we had times where people had to work from home, and how can we track those people. This is what attracted us for Solve Care. I guess around 65 employees so far are using the program. As far as my knowledge, this is a question would be for our human resources, but the feedback that I got and report that it was very simple, quick couple of clicks to get this implemented to our system. I think what I like personally about it is the algorithm to follow the COVID, the health part of it, and the COVID-19 questions. So we were able actually to identify at least 3 or 4 high-risk employees that we had to report this to Human Resources Department, and immediately we took actions by going. I think one of the employees had a positive contact with somebody who was or a positive exposure for the coronavirus, and immediately we were able to act on those cases. We tested them, and good news that they came back negative, and they were able to assume and resume their duties at work with no interruption. So that was kind of a quick before we get into an issue on the back end of things. So it was kind of a proactive approach to those high-risk employees. Well, as I mentioned, how simple it is, couple of steps to use. All employees have this as an app in their iPhones. I think it takes like 1 minute or maybe less than 1 minute to answer the questions. So far, we use it for the tracking COVID and high risk, identifying the high risk employees for this, and kind of, as I mentioned, acting on those. But it's very simple, straightforward. I like the algorithm for giving updates on what to do in case of a high risk person. Well, as I mentioned earlier, life is changing apparently after the COVID for now. So what we call the new normal is this pandemic may be staying with us for a while, since the beginning of the 2000 years, where the SARS viruses have been around the globe now. I think with the new fact that people might be working from home, we are trying to eliminate and mitigate all those spread of that virus. So I think this is a very good application to be used in the future, just in case that we are making sure the well-being of our family at Angel Kids Pediatrics. Any other business can do the same. Communicating with human resources. There are some other features that we didn't even talk about, the well-being of those employees. The fact that some people are working from home to, follow how they are doing, making sure that the productivity, making sure that we address the needs if they are working from home, and not to be disconnected from the environment of work if somebody is working from home, yet they are still connected to the work environment, basically.